Hearing a new diagnosis, like osteoporosis, well, it can really throw you for a loop. So today, we're going to talk about it. Our goal is super simple: to give you a clear, easy-to-understand guide so you can feel a lot more confident about what's next.
If you've just been diagnosed, you might be feeling a bit overwhelmed. And that is completely understandable. There are new words, new questions. It's a lot. So in this explainer, we are going to cut right through all that noise and break down exactly what this means, step by step. Ready? Let's dive in.
So here's our roadmap. First, we'll demystify what that diagnosis really means. Then, we're going to take a peek inside your bones to see how this all happens. We'll talk about the scan they use to check things out, and then we'll get to the good stuff, your action plan. And finally, we'll touch on some of the medical support options you can chat about with your doctor.
Okay, first things first, let's tackle the big question right away. What in the world is osteoporosis? It sounds like a big, complicated medical term, but I promise you the idea behind it is actually pretty simple.
All it really means is that your bones have become a little less dense, a little more fragile over time. Think of it like a honeycomb. A healthy bone has a tight, strong structure. With osteoporosis, the holes in that honeycomb just get a bit bigger, which makes the whole thing less sturdy. Now, if you're feeling like you're the only one dealing with this, let me tell you, you are in very good company. In the US alone, an estimated 10 million people have it, so you're not alone in this journey, not by a long shot. Okay, so we know what it is, but the next logical question is, why? Why does this happen? To get that, we need to understand this really cool process that's going on inside your bones all the time.
So here's a great way to think about it. Imagine your skeleton is like a bank account for bone tissue. Your body is constantly making deposits of new bone. That's called formation. And it's also making withdrawals of old bone. That's called resorption. This happens your whole life. Osteoporosis is just what happens when the withdrawals start happening faster than the deposits. Over time, your account balance, your bone density, gets a little low.
So what speeds up those withdrawals?
Well, a few things. Aging is a big one, especially for women after menopause because of changing hormones. But lifestyle plays a huge role too. Things like smoking or drinking a ton of caffeine can actually make it harder for your body to hold on to bone-building minerals. And not being active? Well, that means your bones aren't getting the signal that they need to stay strong.
So, how do doctors actually look inside and check that bone bank account? They have a really special tool for that, and thankfully, it's a super simple process. Let's talk about the scan. To get that precise measurement, to see exactly how dense and strong your bones are, your doctor will use what's called a bone density scan. If you're picturing something complicated or scary, you can relax. This test is so easy. Seriously, you just lie down on a table for about 10 or 15 minutes while a machine scans you. There are no needles, it doesn't hurt at all, and it's completely non-invasive. It's one of the easiest tests you'll ever have.
All right, we've talked about the what and the why. Now for the best part, the what you can do about it. This is your action plan. This is where you take back control.
First up, we need building materials. And the number one building block for bone is calcium. For postmenopausal women, the goal is about 1,500 milligrams a day. You can get that from things like dairy, leafy green veggies, or maybe a supplement. This is your foundation.
But here's the thing about calcium. It needs a partner to get the job done. Think of vitamin D as the key that unlocks the door and lets the calcium into your bones. A common goal is about 800 international units a day. You can get that from a little bit of sunshine, some foods, and of course, supplements. They're a team.
Next up, movement. Your bones are actually pretty amazing. When you put a little gentle stress on them, they respond by building themselves up stronger. It's their natural defense mechanism. This is why weight-bearing exercises are so crucial. And it doesn't have to be complicated. We're talking about walking, dancing, maybe lifting some light weights. It's that activity that signals your body, hey, we need to be stronger.
Now, diet and exercise are your absolute superpowers here. But sometimes your doctor might suggest some other things to help out. Think of these as extra tools in the toolbox to support all the great work you're doing.
Now there are different types of medications that can help slow down bone loss, or in some cases even help build new bone. These aren't a replacement for those healthy habits we just talked about, but they can be a really powerful ally. This is just to give you an idea of what's out there. This is definitely a conversation to have with your doctor to see if any of these are a good fit for you.
So when you boil it all down, it really comes back to this. While there are medical options, the real, lasting power to build a stronger you comes from your daily choices, what you eat, how you move. That's the true foundation.
So let's end with this.
Let's make it real. Don't think about changing everything all at once. That's overwhelming. Just think, what is one small, totally doable thing you can do today? Maybe it's having a yogurt for a snack. Maybe it's just walking around the block one extra time. Because that one little step, that's where it all begins.